In hospitals, serene on the surface, the drama of life and death is often just around the corner. Farley is the respiratory ward and the place where most of the COVID patients can be found. Over the past weeks, cases here have been ticking up.
We've seen that gradual sort of increase of positive patients, or test results coming back positive, and that's what's happened.
Do you have a sense of when it might peak?
We think with the data that's been shared, possibly by the end of this week.
For a couple of months this summer, there were no COVID cases at all in this hospital. But now it's back, patients are passing away again, and even the indomitable matron here can feel the disappointment.
In the hospital, we haven't had the usual let-up that we would in the summer. We do normally have a little bit of a lull. We haven't had that, so we know that we're gearing up for winter. And yes, we've got COVID, but we've got all the usual winter pressures as well. So that just makes people that little bit more tired.
But this second peak is a relative high, and now it seems quite a bit lower than the first. So they are reaching what the modelling tells them will be the second peak now. But it's quite different on this ward to what we saw in April. For a start, they've only got half the number of beds allocated to COVID patients, and thankfully the numbers dying from the disease are also much lower. So whereas 55 people died with COVID in this hospital during the first wave, the total so far in the second is 7. Many here fear, though, that just as the second wave ebbs away, the government's relaxation of restrictions over Christmas could set them back.
I do worry about the cost to the community, to the health service, of 5 days of people getting together. I mean, my understanding is that some of the high-risk activities are households getting together indoors and having different households and often different generations getting together for several days over Christmas. My understanding is that presents a serious risk to people's health, and yes, I am concerned about that.
This hospital often echoes to music as part of a programme that began before the pandemic, but continues, even al fresco, to soothe staff and patients. Up 2 levels in the cardiac unit, we filmed the resumption of day surgery in June. Shut down for months during the first wave, doctors were left counting the cost of heart patients lost, while the priority was COVID.
The difficulty we've had, of course, is people still have the fear of COVID. There are still some patients who say, actually, I still want to wait for another 6 months before this is all over, and then I'll come and have my investigations and tests done. But of course, the flip side of that is that we have seen increased morbidity and mortality in patients who have been waiting, and they're presented with heart failure and heart attacks. And in some cases, patients have died, so it's still a major problem.
The first lockdown created a backlog, and it remains even though they're working through the second. So how long a wait do patients now expect?
I suspect we're probably looking at 6 to 9 months. So there's still a long way off. So if you present needing a standard investigation or a test, we're still talking several weeks or months before we can get to you, unless you present with an emergency. So we're nowhere near out of the woods yet.
They've managed to keep pretty much everything open here during the second wave, and they're proud of that achievement. Like every other hospital, they had to shut down much of what they were doing during the spring. But the backlog from then remains, and that's got to be cleared. Add to that concerns that easing up over Christmas might even generate a third wave. Hidden away from the hospital is a secret store of PPE laid in for the second wave. There's literally tons of it, from gowns to gloves, gel to visors. They had to plan for the worst, but it's already clear much won't be needed in this second wave. Soon they'll emerge to Tier 2 restrictions. So was the second English national lockdown a blunt instrument in an area where, mercifully, this hospital hasn't come close to being stretched?
The difficulty with regional lockdowns, I sense, is it becomes much more difficult to deliver a message consistently and in a way that people will engage with. And to me, that's the nub of the problem.
Up on level 3, they've stepped up staff flu jabs. 85% have had them, and the target is 90%. There's a reason for the urgency. They want at least a week between flu and COVID vaccines. And this work hints at just how imminent the COVID jabs may be. The hospital wants to be ready by Tuesday and start administering one of the new vaccines as soon as it's certified, they hope, before next week is out.
I would absolutely have it. I'd absolutely have to. You have to trust that it's going to be safe, it'll be effective, and it seems like it's a way out of COVID. COVID's going to be around. It's not going to suddenly go away. So we've got to find a way to vaccinate, same as we do with flu.
If we fast forward to the period where we have a successful vaccine that protects people and stops the virus being transmitted and can be delivered to a significant proportion of the population, then that takes us into a very different place from where we are now, definitely.
This winter promises all manner of stresses and strains on the health service. But once its staff are vaccinated, the COVID pinch on them will be eased, with vulnerable groups in the wider public following soon after. All hopes are pinned on that plan as they motor towards year's end.